Hi, my name is Brian Greenberg. I've had Crohn's disease since age 11 for 24 years, and I've had an ostomy for 7 years. As a man, ostomy surgery is a little bit different because the surgery gets so close to the prostate. So we actually normally do the surgery in 2 steps. You have the surgery to create the stoma and create the ostomy, and then you go back 6 months later or whenever you decide, sometimes longer. For me, it was 3 years, and then you have a second surgery to remove the rectal area if you want to make your ostomy permanent. And it's a very complicated surgery because you have to do it in 2 steps, and they do get so close to the prostate. My surgeon always told me that there was about a 2 or 3% chance that it would impact the intimacy portion of my life, which doesn't seem that much, but he always said, I can give you all the stats, Brian. I can tell you all the ostomy, statistics and everything that goes into a surgery like this. But if it happens to you, it's 100%. So I really want to go through all the processes with you and make sure you're prepared for everything. And that's what I did. So as a young adult, I took everything I could into the decision and really wanted to prepare for it the best I could. I knew I wanted to have a family one day, so I actually even went to a sperm bank and froze sperm and everything just in case the surgery did impact that part of my life. And I was prepared to still possibly have a family down the road. And those are some of the things that guys have to think about with ostomy surgeries because it can impact your life. You really have to prepare for something like this because it's really a lifestyle change. At the same time, for many patients, it gets better and your health improves, your mentality improves, and you're able to do the things that you wanted to do the entire time you were sick.
Girl, you ready?
Before the ostomy surgery, I talked to friends. I found other ostomates in the ostomy community that I could discuss things with. I have a lot of friends who are female, so I was able to bounce things off them quite a bit. The question I always asked them was, would you date a guy with an ostomy? And they all said, yeah, they weren't gonna put me in a bad mood or anything like that. And I remember actually one friend who I went out with, and I was talking to her and I said, well, what are your thoughts on the surgery? What do you think life is going to be like for me? And I asked her, I'm really nervous that the ostomy is going to keep me from meeting the right person. And I remember what she said, and it's something that was extremely powerful at the time. And she said, Brian, the ostomy isn't going to meet you from meeting the right person. It's going to keep you from meeting the wrong person. And ever since then, I live my life like that because if someone isn't okay with my ostomy, then they're not okay with my life and they shouldn't be in my life. All the fears that I had before the ostomy surgery, I learned very fast weren't fears that I should have had at all. People really don't care. They're just happy that you're healthy. They're happy that you got through the battle and they're happy to spend time with you. So a big fear of mine was the intimacy issue, was whether or not I was going to be able to have a relationship, a girlfriend, whether or not I was going to be able to find the right partner that I wanted to be with the rest of my life. And it was never an issue for me. And you're going to bring it up to them. And chances are they're just going to say, all right, that's fine. We'll deal with it. We'll figure it out. But let's just continue having a normal life, continue having a normal date, whatever it is, and go with it. There are ways that you can hide your ostomy even during intimacy. There are companies that make bands and things like that. So if you don't want to have your ostomy out, which I personally don't, there are little appliances or little bands and things like that you can get that'll cover up the ostomy during the time that you want to have intimacy and you don't have anything to worry about. So it's a concern that a lot of guys have, not only with the surgery and how the surgery can possibly impact your intimacy since it does get close to the prostate, but as long as that doesn't happen, and there are pills obviously that can help guys out with that, but you're able to hide the ostomy, you're able to live a normal life, you're able to be intimate the way that you want to be, and it doesn't really impact that life when you find the right partner, and you will find the right partner.